Have you ever had a moment where you thought, I've been taking care of myself just fine? So why do I still feel uncomfortable? If you're a woman over 60, you may be surprised to learn that many of the routines you've trusted for years, the very habits you thought were helping, might actually be making things worse. And the truth is, you are not alone. I'm Dr. Lisa Perriera, a gynecologist with over 30 years of experience helping women through every stage of life. And let me tell you, one of the most common conversations I have with my patients is about self-care. Not the fancy kind you see in magazines with bubble baths and candles, but the quiet, intimate self-care that protects your comfort, your circulation, and your confidence. Here's the shocking part. When women neglect this kind of self-care, or when they practice it the wrong way, it doesn't just affect intimacy. It can increase dryness, raise your risk of infections, weaken your pelvic muscles, and even impact how you carry yourself in everyday life. And the saddest part is that many women don't even realize they're making mistakes until years of discomfort pile up. Let me share a story that captures this perfectly. A woman I'll call Eleanor, 72, came to see me after months of burning and irritation. She sat down in my office and said, "Doctor, I don't understand. I wash every single day with the strongest soap I can find. I thought I was being clean, but I feel worse and worse." When I examined her, I realized the harsh products she had trusted for decades were stripping her body of its natural defenses. What she thought was good self-care was actually the root of her discomfort. Eleanor left my office both relieved because she finally had an answer and frustrated because no one had ever told her that more cleaning wasn't better care. And Eleanor is far from alone. According to the Cleveland Clinic, more than half of postmenopausal women experience intimate discomfort, and yet most never connect it to their daily habits. These women believe their suffering is simply normal aging, when in reality, many of their struggles come from mistakes that could easily be avoided. I like to compare it to taking care of a wooden table. Imagine you polish it every day with harsh chemicals, believing you're protecting it. Over time, instead of shining, the surface wears down. Or imagine you never oil the wood, leaving it dry and cracked. The table still stands, but it looks worn, fragile, and neglected. Your body is the same way. The wrong kind of care or a complete lack of care doesn't protect you. It quietly wears you down. This is why today's video is so important. We're going to talk about the 5 most common self-care mistakes women over 60 make. These aren't rare or unusual. They're everyday habits I see over and over in my patients. And chances are you might be making 1 or 2 of them yourself without even realizing it. But don't worry, by the end of this video, you'll know exactly what those mistakes are, why they're harmful, and what simple, natural alternatives you can start today. And let me be clear, this isn't about shame. You haven't done anything wrong. The truth is, most women were never taught how to adapt their self-care after menopause. We grew up hearing cleaner is better, or intimacy isn't important at your age, or leakage and dryness just happen, live with it. But science and decades of patient care tell me otherwise. Your body can thrive when you give it the right kind of attention. So as we go through this together, I encourage you to listen with curiosity, not guilt. You may recognize yourself in 1 or 2 of these mistakes, and that's okay. Awareness is the first step toward change. Now let me ask you, when you think about your own self-care, do you feel confident that you're supporting your body the right way? Or have you ever wondered if some of your habits might be doing more harm than good? I'd love for you to share your thoughts in the comments, because chances are another woman watching this is wondering the exact same thing. Stay with me, because in just a moment, I'll begin walking you through mistake number 1, and I promise, it's something you may not expect. Let's dive into the first mistake, one that I see so often in my practice: overcleaning with harsh soaps or douches. Many women believe that being extra clean means washing multiple times a day with strong, perfumed products. After all, we've been taught since childhood that cleanliness is next to godliness. But when it comes to your intimate health, overcleaning can do more harm than good. According to the Cleveland Clinic, the vagina is naturally self-cleaning. It produces secretions that help flush out bacteria and maintain a healthy balance of protective organisms. When you introduce harsh soaps or chemical douches, you disrupt that balance. The healthy bacteria die off the tissues, become dry and irritated, and you may actually become more vulnerable to infections. One of my patients, Patricia, 74, illustrates this perfectly. She was meticulous about hygiene, showering twice a day, scrubbing with antibacterial soap, even using a commercial feminine spray because she thought it kept her fresh. But over time, she developed chronic burning and recurrent urinary tract infections. Patricia told me, "Doctor, I thought I was being careful. I never imagined my hygiene was the problem." Once she stopped using harsh products and switched to warm water and a gentle, fragrance-free cleanser just once a day, her symptoms improved dramatically. Her story is a reminder that sometimes more isn't better, especially when it comes to intimate care. I often compare it to washing silk. If you scrub delicate fabric with bleach every day, will it last? Of course not. It will fray, lose its texture, and wear down far faster. Your tissues after menopause are just as delicate as silk, and they require the same gentle care. Overcleaning isn't protection, it's slow destruction. Now let's talk about the second mistake: ignoring hydration and natural moisture. After menopause, estrogen levels decline. This hormone isn't just about fertility, it helps maintain the elasticity and thickness of your tissues. When estrogen decreases, your intimate skin becomes thinner and drier. Without support, even simple activities like walking, sitting, or exercising can feel uncomfortable. Many women accept this as just aging, but that's not true. Dryness and fragility are signals that your body needs help. The Mayo Clinic reports that up to 50% of postmenopausal women experience vaginal dryness. That's half of all women, and yet so many never seek solutions. Why? Because they're embarrassed, or because they assume nothing can be done. But hydration and moisturizing are powerful tools. Drinking enough water each day supports your tissues from the inside, while applying a safe water-based moisturizer or vaginal gel helps from the outside. These aren't luxuries, they're basic forms of self-care. I remember a woman named Ruth, 68, who avoided social gatherings because she was always uncomfortable. She confessed, "Doctor, I don't even feel like myself anymore." She rarely drank water, relying instead on coffee and tea throughout the day, and she never moisturized her intimate area because she thought it was unnecessary. When we added just 2 simple steps, drinking water regularly and using a fragrance-free moisturizer twice a week, her comfort improved dramatically. She came back to me smiling and said, "I can finally sit through church service without squirming." Sometimes it's those small adjustments that restore both physical ease and emotional peace. Think of it this way: would you leave your hands unmoisturized all winter and expect them not to crack? Or would you plant a flower in dry soil and expect it to bloom? Your intimate tissues are no different. They need steady hydration inside and out to remain supple and strong. So when you combine these first 2 mistakes, overcleaning and ignoring moisture, you see a pattern. One strips away your body's natural defenses, the other deprives your tissues of the nourishment they need. Together, they set the stage for discomfort, infections, and even a decline in confidence. Here's what I'd love you to reflect on. Have you ever thought you were doing the right thing by washing too much or skipping moisturizers, only to realize later that your body felt worse not better. If so, you're not alone. Many women share this experience, and talking about it helps break the silence. Share in the comments. If either of these mistakes sounds familiar, you might be surprised how many women nod in recognition when they read your story. And stay with me, because the next mistakes we'll talk about may shock you. They don't just involve hygiene, they touch your relationships, your confidence, and even your independence. The third mistake I see far too often is avoiding intimacy altogether out of fear of discomfort. This happens quietly, almost without notice. A woman may have one painful experience, and then she begins to hesitate. Over time, she withdraws more and more until intimacy becomes something she no longer even considers. She tells herself it's simply part of aging. But here's what I want you to understand. When you stop all forms of intimacy, whether with a partner or with yourself, you don't protect your body. You actually accelerate the very problems you're trying to avoid. The Cleveland Clinic has shown that regular stimulation helps maintain blood flow, keeps tissues flexible, and reduces the thinning that often leads to pain. Without that circulation, dryness worsens, muscles weaken, and discomfort grows. It's a cycle. Fear leads to avoidance. Avoidance leads to more pain, and the pain reinforces the fear. I remember a patient named Helen, 70, who came to me almost in tears. She said, "Dr. Perriera, I've closed that chapter of my life. My husband doesn't even try anymore because I push him away." When I explained to her that even gentle touch-holding, caressing, or self-pleasure could help restore blood flow and reduce pain, she was shocked. She thought intimacy was over, but what she needed was a new approach. After a few months of small steps, she told me, "For the first time in years, I don't feel broken. I feel hopeful." The fourth mistake is believing lubricants are only for sex. This one surprises many women. They walk past the aisle in the pharmacy thinking lubricants are for younger couples, or they feel embarrassed to even put one in their shopping cart. But lubricants are not just for intercourse, they are everyday tools for comfort. They protect tissues from tiny tears, reduce friction, and help restore confidence in your body. One woman, I'll call Denise, 66, admitted she avoided buying lubricants because she thought it was shameful. She whispered to me during her appointment, "Doctor, that's for other women, not for me." But after she finally tried a simple water-based lubricant, she came back laughing. "Why did I wait so long? This feels like I gave myself back a piece of my life." That's the truth. I wish every woman over 60 could hear lubricants are not a sign of weakness. They're a smart form of self-care. And then there's the fifth mistake, one that gets overlooked again and again, forgetting the pelvic floor. Your pelvic floor muscles are like a hammock, supporting your bladder, uterus, and rectum. With age, and especially after menopause, these muscles weaken. When ignored, this can lead to urinary leakage, pelvic organ prolapse, and even a loss of sensation. Yet most women never think about exercising them. According to the Mayo Clinic, pelvic floor exercises, or Kegels, can significantly improve strength and circulation even in older women. These exercises don't require equipment, and they take only a few minutes a day. But the benefits are life-changing. One of my patients, Maria, age 72, used to avoid going to her granddaughter's soccer games because she was afraid of leakage when she laughed or cheered. After 3 months of daily Kegels, she came to me beaming, "I went to every game this season, and I didn't have a single accident." That freedom gave her back more than comfort. It gave her confidence to rejoin life. When you look at these 3 mistakes together, avoiding intimacy, dismissing lubricants, and neglecting the pelvic floor, you see a pattern. Each of them comes from silence, from embarrassment, from the belief that after 60 these things don't matter anymore. But they do matter. They matter for your health, for your relationships, and for your dignity. I want you to pause and reflect. Have you unintentionally slipped into one of these patterns? Maybe you've avoided intimacy because of pain, or dismissed lubricants because of stigma, or forgotten about the importance of your pelvic floor. You are not alone. Millions of women are quietly struggling with the same things. But the good news is that with awareness and small, consistent changes, your body can respond even decades after menopause. So let me ask you, of these three mistakes, which one feels most familiar to you? And which one feels like the easiest place for you to start making a change? Share in the comments. Your words might be exactly what another woman needs to hear to take her first step forward. And stay with me, because in the next part, I'll share the story of a woman who transformed her health and confidence by correcting these very mistakes. Her journey proves it's never too late, and it might just inspire you to begin your own. To really understand how powerful it can be to correct these self-care mistakes, let me share with you the story of a woman who walked into my office carrying years of frustration and walked out months later with a renewed sense of herself. Her name was Carol, 68 years old, a retired librarian. When she sat down across from me, I could see the weight she carried. She said, "Dr. Perriera, I feel like my body has betrayed me. Everything feels dry, uncomfortable, and I don't even let my husband come near me anymore." She confessed she had been scrubbing daily with soap because she thought it was good hygiene. She admitted she avoided intimacy because every attempt ended in pain. She never used lubricants. She thought they were only for younger women. And she had never once in her life done a pelvic floor exercise. By the time Carol came to me, she wasn't just dealing with physical symptoms. She was carrying shame distance from her partner and the belief that her best years were behind her. She whispered to me, "I guess this is just what happens after menopause. Maybe I should stop expecting more." But here's the truth. Our bodies may change after menopause, but they don't stop deserving care. I told Carol exactly that. Together we made a plan, not overwhelming, but gentle and consistent. Step 1. Stop the harsh soaps. Switch to warm water and a mild, fragrance-free cleanser once a day. Step 2. Hydrate drink water throughout the day and use a simple vaginal moisturizer twice a week. Step 3. Introduce a water-based lubricant, not as something shameful, but as a tool for comfort. Step 4. Practice pelvic floor exercises just a few minutes each night before bed. At first, Carol was skeptical. She told me, "Doctor, I've lived like this for years. Can a few small changes really make a difference?" But within 6 weeks, she returned to my office smiling. "I don't feel burning anymore," she said. After 3 months, she told me she and her husband had shared intimacy again, gently, without pain, for the first time in years. And perhaps most importantly, she looked me in the eye and said, "I feel like I belong in my body again." Her transformation wasn't magic. It wasn't surgery or expensive medication. It was simply awareness replacing mistakes with habits that honored the way her body had changed. I often explain it with this analogy: your intimate health is like a garden. If you neglect it completely, weeds take over and the soil dries out. If you drown it with harsh chemicals, the plants wilt. But if you tend to it gently, water it, nourish it, give it sunlight, it flourishes, even after many seasons. Carol's body was the same. For years, she had either neglected or mistreated her garden. But once she gave it consistent, thoughtful care, it bloomed again. Science confirms what Carol experienced. The National Institutes of Health notes that women who maintain self-care routines after menopause not only reduce physical discomfort, but also report higher quality of life, better mood, and improved relationships. The benefits go beyond the physical they touch: confidence, intimacy, and even social engagement. Carol's story reminds me of something I wish every woman over 60 could hear. It is never too late. Even if you've made these mistakes for years, your body is resilient. With small, consistent changes, you can see improvement, not decline. So let me ask you from the heart, if you imagine your own garden, how would you describe it right now? Has it been neglected, over-scrubbed, or simply waiting for a little care? And what would it mean for you to see it bloom again? Not just for your body, but for your confidence and your joy. We've covered a lot of ground today, so let's take a deep breath and reflect on what we've learned together. The truth is, most women over 60 are doing their very best with the knowledge they have, yet without realizing it, they often fall into 5 common self-care mistakes. Mistake number 1, overcleaning with harsh soaps or douches, stripping away the body's natural defenses. Mistake number 2, ignoring hydration and natural moisture, leaving tissues fragile and dry. Mistake number 3, avoiding intimacy altogether, which only accelerates thinning and discomfort. Mistake number 4, believing lubricants are only for sex, when in reality they are simple tools for everyday comfort. And mistake number 5, forgetting the pelvic floor, those essential muscles that support our strength, continence, and even sensation. Each of these mistakes on its own may not seem catastrophic, but when added together, they quietly chip away at comfort, confidence, and quality of life. What starts as mild dryness can become recurrent infections. What begins as one painful experience can lead to years of avoiding intimacy. What feels like minor leakage can grow into a fear of leaving the house. This is not just about physical health. It's about dignity, relationships, and the freedom to live without fear or shame. But here's the hopeful part. Every single one of these mistakes can be corrected. And the solutions are not complicated. They are small, natural, consistent habits. Choosing warm water instead of harsh soaps. Drinking water throughout the day and adding a gentle moisturizer. Allowing yourself gentle intimacy with or without a partner to maintain circulation. Embracing lubricants as an ally, not an embarrassment. Practicing pelvic floor exercises daily, just as naturally as brushing your teeth. These are not radical changes, they are quiet acts of respect for your body. I think back to Carol's story, the woman who felt her body no longer belonged to her. She thought it was too late, that nothing could change. But by letting go of the mistakes and embracing these new habits, she found her way back to comfort, intimacy, and confidence. And if Carol could do it after years of struggle, so can you. I like to imagine 2 paths stretching out before women after 60. On one path, self-care is neglected or misdirected, and the body grows more fragile. Confidence shrinks and intimacy fades. On the other path, self-care is nurtured, the body is supported, intimacy becomes gentle and fulfilling, and confidence radiates outward. Both paths are possible, but only one leads to a life of dignity and vitality. And the choice starting today is in your hands. So here is my invitation. Choose one small step this week. Maybe it's putting down the antibacterial soap. Maybe it's adding a moisturizer to your routine. Maybe it's doing 10 pelvic floor squeezes tonight before bed. You don't have to change everything at once. But one small change repeated consistently has the power to transform your health and your confidence over time. And I'd love to hear from you. Which of these 5 mistakes resonated with you the most? And which small step are you willing to begin today? Share your answer in the comments, because your voice could encourage another woman to take her first step too. If you found today's video helpful, I invite you to subscribe so you don't miss the rest of this series. In the next episode, we'll explore the natural self-care habits that not only protect your intimate health, but also help you thrive with energy, comfort, and joy well beyond menopause. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.